Government for the crisis that led to the loss of so many lives.
Before you get there, they had never seen uniformed policemen, let alone these mobile policemen that are so heavily. Of Lafia.
The security forces were doing their legitimate responsibility to.
We do apologize for the poor audio quality of that report. An international office of the Bayelsa State Development and Investment Corporation, BDIC, has been commissioned in Johannesburg, South Africa. A high turnout of dignitaries from Nigeria and South Africa attended the event, amongst whom was the Minister of Finance, Dr. Ngozi Okonjo-Iweala, who represented President Goodluck Jonathan. The Bayelsa State Governor, Seriake Dickson, who hosted the gathering, says this is just the first amongst a number of planned international cities that will be used as retail points to foster business relations between his state and the rest of the world. Our correspondent Betty Dibia reports.
It's located at Commerce Square on Rivonia Road near Sandton in Johannesburg, an impressive office space set up for an impressive purpose. As part of its efforts to expand the economic frontiers of the state, the Bayelsa state government says it's developing solid partnerships for increased wealth creation through the Bayelsa Development and Investment Corporation. And it's starting through outreach points like this office in Johannesburg, South Africa.
In the name of God, for the benefit of humanity. Amen.
The Bayelsa State Governor, Henry Seriake Dickson, took his guests on a guided tour, after which the party moved outdoors. The governor began by assuring the gathering that his state is indeed a safe place to visit and invest in. The goal is to make Bayelsa State among the top 5 state economies by 2020.
What we are trying to do is to promote African enterprise by Africans and for Africans beyond the level of political cooperation. We in Africa and governments in Africa to promote business-to-business interaction so that we can create wealth.
The BDIC has an approved takeoff grant of 10 billion naira, and the mandate comprises developmental, infrastructure and investment financing, as well as operating a holding company for the state's investments. Nigeria's finance minister, who represented President Goodluck Jonathan, lauded the initiative but says performance monitoring is essential.
To create the potential for this state to be a driver within the Nigerian economy is a strong one, and that is why building an outpost here to attract investment into Bayelsa is something of a new move, which we think is a good move and will succeed.
And to buttress the beauty of such cooperation, the Obodin Sol Group from Nigeria and Amaskandi Group from South Africa added color to the evening. Betty Dibia, Channels Television News.
And now to health issues. Nigeria has not really made significant improvement in mother-to-child death-related cases, and this is according to the State of Mothers 2013 report. At the presentation of the report by Save the Children International to the Lagos State Ministry of Health, the country director of the organization, Dr. Susan Grant, said more resources is needed to achieve the Millennium Development Goal 4 to enable more mothers, especially in the rural community, get better health facilities.
More than 1 million babies die on their first day of life, which affects both the rich and the poor. And this is according to the 2013 World Report on Mother and Child, which was presented in Lagos. It further states that the day a child is born is far the most dangerous single day of its life. Here in Nigeria, the case is not different, as the country is rated the 12th highest of first-day deaths in the world, making Nigeria one of the riskiest places in the world to have a baby, as well as one of the countries with the most first-day deaths.
Thousands of them die every year. many of them on the first day when they deliver their babies. And of course, with babies, there's been a lot of deaths. Over 254 babies die every year. And 50% of those deaths happen on the first day.
We have been working with the government but also civil society to ensure that some low-cost and high-impact interventions to save newborns is going to be replicated, hopefully, throughout all of Nigeria.
Although government is doing its best to ensure that all children and their mothers have access to good healthcare delivery in the country, it is still inadequate compared to what other countries within the African continent are achieving. The resources that is dedicated to the health sector needs to be improved upon for the country to achieve the Millennium Development Goal number 4. Receiving the report, the Commissioner for Health in Lagos State, Dr. Jide Idris, also said part of the recommendation of that report will aid the state's effort in reducing mother-to-child death-related cases in the state.
The report of the 2013 State of the World Mothers is being launched. There's a lot that is being done, and with more effort from other stakeholders like the partners as well, I'm sure we're going to improve the state of the mother and child.
With the National Health Bill pending in the National Assembly, which have provisions for free healthcare services for pregnant women and children from 0 to 5 years of age to get free access to medical services, it is believed that if the NHS bill is passed into law, it will reduce to the minimum the case of mother and child death-related cases in the country.
Nigeria's National Health Bill has been swimming in troubled waters. The stumbling blocks to its seeing the light of day have been set in by infighting over professional supremacy in the health sector. Our focus on health is on the new hurdle before the National Health Bill and why Nigerians must not be made to wait any longer.
It's been a bumpy ride for Nigeria's National Health Bill, which seeks to provide a framework for standards and regulation of health services in the country. Since its first draft in 2004, the bill has gone through several readings and refinements by both the Senate and House of Representatives and was finally passed by the 6th National Assembly in May 2011 and sent to the President for assent. The joy of its passage was short-lived as President Goodluck Jonathan did not sign it into law but returned it to the National Assembly in 2012, perhaps owing to bureaucratic bottlenecks and dissenting views coming from the various stakeholders in the health sector.
The thorny issue actually was on the issue of whether to import zygotes or export zygotes and embryos, which the Christian Association and religious bodies opposed to, and whether we could do cloning or not. Those were the actual challenges that stopped it from being signed into law.
Since its return, the National Health Bill has gone through revisions in both the Senate and House of Representatives, with a public hearing in February 2013. A fresh setback to the bill came in April during a clause-by-clause consideration of the document. Clauses 1 to 10 were passed, but Clause 11, which in part seeks to finance the National Primary Healthcare Development Agency from Nigeria's Consolidated Revenue Fund, was greeted with divergent views.
The vision here in this act establishes, it says, Clause 1, establishment of National Primary Healthcare Development Agency. 2, establishment and composition of governing board. 3, functions of the agency. 4, appointment and executive director and other staff. 6, zones. 7, fund of the agency. Then expenditures of it and so on. Everything that is sought to be, much of what is sought, all that is sought to be done by this provision of Clause 7 or Clause 11 is repeated here in the National Primary Healthcare Development Agency Act.
You can only charge fund of the Federation through by amending the Constitution. But you can't make a bill and charge funds of the Federation to create a fund.
Some standalone regulations and legislations have come into effect before now, and that includes the National Primary Healthcare Development Agency. What this bill states in this part is not to repeal the national primary health care, but we just made a reference to it because it's supposed to